Hello, everyone. Have you ever wondered why people delay seeking help? Even if you didn't, Safer et al. Did. In 1979, there was this research that was conducted by Safer et al., where they were trying to figure out the factors that could possibly lead to individuals delaying seeking medical treatment. Now, if you talk about this particular study, you'll come across this study while preparing yourself for paper, health psychology for paper 3 and 4. Uh, the first chapter, that is the first unit from health psychology, that is patient practitioner relationship. And within that chapter, the third section, that is the last section, that is misusing health services. So, without any further ado, let's begin with this study. This particular study, this is an example study. When I use the word example study, the examiner wouldn't really directly ask you questions on this specific study. I mean, you'd get questions where it would be very evident that the examiner is looking forward towards you putting the knowledge that you gain from this particular study to use, but you will not get a question that specifically demands you having to write down about Safer et al. So taking this ahead, this study, like I said, was conducted by Safer et al. In 1979. They tried investigating the reasons for delay in seeking medical care. Now, when you talk about delaying medical care, what Safer et al. Figured out towards the end was that there were three main stages that individuals typically go through when they're delaying seeking medical help. And they named them as number one, appraisal delay, number two, illness delay, and the third one over here was utilization delay. Now, what is appraisal delay? How is appraisal delay different from illness delay? And how is illness delay different from the utilization delay? So, to move on, if we speak about the first category or the first stage over here, the first stage, like I said, is appraisal delay. This is the amount of time an individual takes to recognize that the symptoms he or she is experiencing is actually an illness. At times what happens is you just don't feel right. You just don't feel the best. You just don't feel that you're totally okay. That moment when you're not feeling okay, from the moment that you actually recognize and accept that you're ill, that delay, we're referring to that as appraisal delay, right? From the time you're experiencing symptoms to the time you actually realize, accept, recognize that your symptoms are actually an illness. Number one. Number two, the second category or the second stage that we have over here is illness delay. What is illness delay over here? The time period between you recognizing that you're ill and you finally being serious and deciding that that you need to get some medical help, right? So the first stage, when you've experienced symptoms, from you experiencing symptoms to you deciding or recognizing or accepting that you are actually ill, right? Now, the second stage, when you finally realize that you're ill, the time period that you take between you realizing you're ill and you deciding that you need to take yourself or you need to go visit a consultant. The third category over here is utilization delay. What exactly is utilization delay over here? As we speak about utilization delay is the time when you've decided that you need to go visit a consultant. From the time you've decided you need to go and visit a consultant to the time that you actually reach the consultant's clinic, right? So we are talking about three major stages that Safer et al. Had identified that individuals go through as when they're delaying medical treatment, right? So the first one being appraisal delay, the second one being illness delay, and the third one over here is utilization delay. Now, these factors, they influence each stage. The factors that influence each of the stage over here were explored. If we talk about those factors, they had put them into six main categories. The first one was sensory. The first factor was sensory factors such as you experiencing pain, you bleeding. The second factor over here was self-appraisal process. Now, what is self-appraisal process over here? When you're observing the symptoms or when you're trying to see if there has been any change in your symptoms. The third could be a coping response. Now, your coping response to those symptoms could be, in many cases, individuals end up using home remedies. The fourth factor that they were trying to look into was the emotional reaction as well. Many individuals experience distress. The fifth factor was the imaginal consequences. There are some people who might mentally imagine them having to go through a surgery. That could be another factor that could delay them seeking help. And the sixth factor that they tried looking into was situational barriers such as not having time to go visit a consultant, or it could even be cost, right? It could even be cost could be an important factor that could affect an individual's decision of seeking medical help. So moving on, factors influencing each stage were explored, including sensory experiences, emotional reactions, coping strategies, as well as situational barriers. Now, about this study was conducted in a waiting room of 4 clinics of a large city hospital. Now, the study included 93 patients. There Out of these 93 patients, we had 38 males and 55 females. Now, since this is an example study, it is totally okay if you do not learn all of these specifics. Just know that you could possibly get a 6-mark question. Now, once we're done with the study, I'll show you a question that we had, I believe, in the specimen paper. And through that question, by having a look at that particular question and the marking theme, you'd see how the examiner hasn't really named this particular study, but the examiner is expecting you to have a basic know-how to be able to put in your answer. Now, taking this ahead, the study included 93 patients, 38 being males and 55 being females, who attended clinic for the first time for specific illnesses. Participants completed interviews and questionnaires. Bear this thing in mind, both interviews and questionnaires, they're examples of a self-report measure. Now, these participants, they completed interviews and questionnaires, measuring the stages of delay and total delay time, measuring the different stages of delay and the total delay time, right? With both open and closed questions. Of course, open questions would give you qualitative data. Closed questions would give you quantitative data, and they both have their own pros and cons, which you as a student should keep in mind while you're preparing for your examination. Results showed no significant correlation between the length of the 3 stages. The median delay of was 8 days, though the mean was longer at 57 days due to a few extreme cases. Now, I'm assuming we all know the difference between median and mean. Mean is your average and median is your middle number, right? So the median total delay was 8 days, right? Out of the 93 participants, the data that was obtained out of 93 participants, the middle data over here was 8 days. Number one. Number two, the mean was longer at 57 days. Mean or the average over here was 57 days, which of course is a lot. And according to Safer et al., this number, or this 57 days, which is a lot, it's probably because there were certain extreme cases. Of course, when you're taking out average, if you have extreme numbers there, your average turns out to be more. Now, taking this a little further, if you guys have a look at this diagram, if we may call it. So the first stage, when you as a potential patient, you're noticing symptoms, right? You question yourself if you're ill or if you're not ill. Let's just say you have recognized and accepted that you're ill, and then you move on to the next stage, that is you're questioning yourself, do I need professional care? And if your inner self says yes to that as well, the next question that you'd probably think of is, that would probably occur to you is that care worth the cost? Now, cost over here does not necessarily have to be monetary cost. It could be cost in terms of you having faith in the medical system. I mean, would you have your cure? Would you be cured? Or this cost maybe in terms of you having to spare some time out of your maybe busy schedule. So number one, you notice your symptoms. Once you've noticed your symptoms, you question yourself if you're ill or if you're not. If you think you're ill, the next step is you'd ask yourself if you need any sort of professional care. If you have a yes to that question as well, the next question that would occur to you is that care worth the cost? And if you have all the yeses to the questions over here, you'd eventually enter the treatment, or you'd go see the clinician or the general practitioner, go visit a consultant. Now, let's just say if the answer to this question, am I ill, is no, that would lead to a delay, right? Let's just say you get a yes to this, and the next question that comes in your mind is, do I need professional care? And if the answer that you have in your mind is no, you're probably someone who is looking forward towards home remedies. You're probably someone who is expecting to be okay with time, right? But let's just say you have a yes from here, you have a yes from here. The third one is that care worth the cost? And if you have a no to that as well, that would lead to delay. So do you see we talking about these three different stages? To learn them, they are the first one being appraisal delay, the second one being illness delay, and the third one being utilization delay. Now, having a look at the key findings on total delay over here, the most significant predictor was a competing life problem, such as marriage or divorce. Now, the most significant predictor of total delay over here was in terms of life problems, could be marriage, could be divorce. Those without such issues delayed 7.2 days. However, those with these issues, they ended up delaying for around 23.8 days, right? So your life problems or situational factors could be playing an important role over here. The first one. The second key finding from this study, patients with painful symptoms, of course, delayed less as compared to patient who did not have any painful symptoms. And if you have a look at the quantitative data over here, the patients who did experience painful symptoms, they ended up delaying around 8.6 days, the average year, and the patients who did not experience any painful symptom, they ended up delaying 23.3 days. The third key finding, reading about symptoms. Now, bear this thing in mind, this particular study that we're talking about was conducted in 1979. And guess what? In 1979, you did not have Google. If you're someone who has read about the symptoms, when we're visiting a doctor, there are many reasons. One of the major one is us looking forward towards being cured. But at times we want to go see a doctor because we're not sure about what is wrong with us, right? So if you're talking about someone who has already read about the symptoms, that might eventually lead to that particular person, the potential patient over here, delaying treatment. So reading about the symptoms increased delay. No reading resulted in 11.5 days delay, and reading a little led to 26.4 days, whereas extensively reading led to a delay of 50.2 days. That's quite a lot, right? So reading about the symptoms, as we clearly see, as Sefer et al. Clearly show us, that had a key role, or that was a significant factor, that contributed towards the patient's overall delay. The fourth key finding here, age. Patients under 45 years delayed 9.1 days, while patients, those who were over 45 years, they delayed 23.5 days. So age again is a significant contributor, according to Sefer et al., that led to delay. The older you are, the more you delay. The younger you are, the lesser you delay. The fifth key finding, patients who believed that their symptoms could be cured delayed 9.4 days. However, the patients who believed that their symptoms could not be cured, they delayed treatment, or they delayed seeking help for around 15.2 days. If I talk about myself or the people that I know of, if someone's having flu, also referred to as influenza, there are many people who wouldn't want to go seek help because they know flu takes its own time, right? So if you think the symptoms you're experiencing can be cured, the delay time is less as compared to you believing that your symptoms cannot be cured. So these were six major findings of this study that was conducted by Safer et al. In the year 1979. The first one having to do with life problems, the second one having to do with your sensory or perceptual experiences such as painful symptoms, the third one having to do with you reading about the symptoms, the fourth one having to do with your age, and the fifth one about your perception about your symptoms being cured or not. Now let's take this a little further. If we speak about appraisal delay, if you have a look at the results here, and speak about appraisal delay, the average over year was 4.2 days. For illness delay, it was 3.1 days. And for utilization delay, it was 2.5 days, right? Now, what is appraisal? Now, if you have a look at a bit more of detail here, if an individual had painful symptoms and was bleeding, that particular individual reduce, and that these two factors, they reduced the delay, right? One. Number two, if an individual read about the symptoms, this led to an increase in delay. The first key finding related to appraisal delay. Moving on, if we speak about illness delay over here, newer symptoms reduce delay compared to familiar symptoms. If an individual is familiar with the symptoms, you already know what you're going through, that might lead to you being okay with delaying your treatment. But if you come across newer symptoms, you might be curious and a little worried too, which might eventually lead to you reducing the delay and immediately wanting to seek medical help. The second key finding related to illness delay over here, negative imagery. Imagining yourself having to go through a surgery might lead to you increasing your delay. Now, there are many people, they're not brave enough to accept that they'd have to go through a surgery, which possibly could be a reason why they must have delayed their treatment. Now, moving on, the third stage, that is utilization delay. Cost, that is a situational factor, increased delay. One. Number two, painful symptoms, reduced delay. Number three, belief that symptoms could be cured, shortened your delay. Now, if we conclude this study real quick, total delay was influenced by factors such as situational factors, your sensory factors, your conceptual factors, your social demography. Your age is an example of your social demographic factor, and emotional factors, the amount of distress that you're experiencing. So total delay was influenced by situational factors, sensory factors, conceptual factors, social demographic factors, and emotional factors. Each stage of delay was predicted by different combinations of these factors. Appraisal delay by sensory, let's highlight this. Appraisal delay by sensory and appraisal strategies, illness delay by sensory and imagery factors, and utilization delay by sensory, conceptual, and situational factors. Now, these findings highlight the complexity of patient behavior in seeking medical care. You know, when I initially started this lesson, when the first question that I'd asked you was, do you wonder why? Do you wonder why people delay seeking treatment? I'm sure none of you must have thought about the complexities behind all of this. Like I'd initially said, you probably did not think of this, but Safer et al. Did. And as we see through these key findings, they highlight the complexity of patient behavior when it comes to seeking medical help or seeking medical treatment. Now, this was the question that I was talking about. I'm sorry, at the beginning, I'd probably said this. We had a question on this in the specimen paper. No, it's not the specimen paper. So we had a question in May, June 2024, zone 4, that is 3-2 variant. And if we have a look at this question, the question over here reads, describe a study investigating reasons for delay in seeking treatment and a study on Munchausen syndrome. See, the examiner isn't really clearly specifying that you need to study, that you need to use the study that was conducted by Safer et al. But we do realize we need to put our knowledge on the study that was conducted by Safer et al. To use over here to be able to answer this question. Now, when I use the word example study, if you guys have a look at your syllabus that is published by Cambridge, it's not necessary. It's not necessary when the examiners in the syllabus write down example study, that doesn't necessarily mean that you have to mention this particular study conducted by Safer et al. You could alternatively write down about any other known study, any other published study that explains you delay in seeking treatment. Now, why is it that us teachers, we advise students to stick to the course book? Because if we allow students to write any study of their choice, we cannot be sure, we cannot be certain if they'd actually be able to identify and get hold of the right study. So if the course book that is published by Cambridge has put up example studies for us, why not use them? Moving on, describe a study investigating reasons for delay in seeking treatment and a study on Munchausen syndrome. In our lesson today, we're not discussing this study that was conducted by Aleem and Ajarim. And this study is about Munchausen syndrome, for which I'd record another lesson. So this is a typical 6-mark question. And in this particular 6-mark question, before we have a look at the marking scheme over here, I'd want you all to go through this guidance as well. And this is a Cambridge published document. Avoid up to 4 marks where the response has described only one part of the question. Remember, this particular question is catering to two different things. There are two different parts of the syllabus that the Cambridge is demanding you to reproduce in your answer. So award up to 4 marks where the response has described only one part of the question, even if the response otherwise meets the criteria for level 3. So regardless of how well you've written your answer, but if you're just catering to one part of the question, you would not get anything more than 4 marks. So for you to be able to hit a 6 on 6, you need to be aware about a study. Could be any study. In our case, we're using the study that was conducted by Safer et al. Because this study is about delaying seeking treatment, and another study that exemplifies Munchausen syndrome. Now, taking this a little further, at this point, I'd like to advise students to try to acclimatize yourself with your syllabus. It's simple. You open Google, you type down A-level psychology syllabus for 2025, syllabus code 990, the syllabus link that you come across, you open it, have a look at the syllabus, and try acclimatizing yourself with the syllabus, or try making yourself familiar with the syllabus, or I'd rather want to say, try memorizing it. Now, how is it, or why is it that I'm advising you to memorize the syllabus? Because do you know what? How else would you know what particular study can be used or should be used for what particular topic, right? I know this because I've been doing this for almost 2 decades now. You as a student, you're new to this, and the likelihood of you confusing one study with another is a lot. So a piece of advice over here is make sure that you know your syllabus well. Quickly moving on towards the marking scheme over here. So delay in seeking treatment, Safer 1979. This study, like I initially said, was done in a waiting room of 4 clinics of large city hospital. There were 93 patients, 38 being males, 55 being females, with an average age of 44 years. Patients with severe illnesses were excluded. Most patients had mild complaints. 45-minute interview and questionnaire where they were interviewed. Questions asked about the types of delay, dependent variable, and predictors of delay was the independent variable over here. They measured total delay made up of appraisal delay, illness delay, and utilization delay. Results found that there were 3 stages or types of delay: appraisal, illness, and utilization. A variety of factors predict the length of the delay for each of the 3 stages. For example, for appraisal, awareness and evaluation of symptoms. Well-defined and specific, shortened. Appraisal delay, attempting home remedies. For illness delay, whether the illness is perceived as mild or severe. Beliefs and benefits, discomfort of treatment. For utilization delay, I'll just highlight all 3 of them. So it's a little easier for you. So utilization delay here, illness delay here, and appraisal delay over here. Now, for utilization delay, efforts to make and attend appointment, costs of treatment, complications in life setting that might prevent seeking treatment. Example, availability of childcare. Safer et al. Concluded that a wide variety of factors affect total delay in seeking treatment. Strong sensory signals, example, high levels of pain, led to shorter delays. The more patients researched their illness, the longer they delayed. Now, you see what we have discussed in the study mentioned over here. Question yourself. This is a 6-mark question, right? A 6-mark question that is demanding knowledge on 2 different studies. A study that has to do or that exemplifies delay in seeking treatment, and another study that exemplifies Munchausen syndrome. Question yourself, will you be able to write all of this in, wait, let me calculate. For 6 mark question, you get 9 minutes in total, give or take. So will you be able to write all of this in 4 minutes? If not, rephrase this. If not, make it a little, shorten this up a little, and try to learn what you can learn to be able to exemplify delay in seeking treatment. Bear this thing in mind. This is an example study. No one's going to ask you specific questions related to the sample of the study, related to, yeah, you might want to use that while evaluating this particular study, but no one's going to ask you direct questions about, like I said, the sample, the data collection techniques, so on and so forth. So you know yourself better. Try putting this on paper, this entire thing, see how long it takes. And if it is taking anything more than 4 minutes, it's not worth it. Remember, there are time constraints. It is a 60-mark paper for which you get 90 minutes. That, in other words, means you do not get anything more than 1.5 minutes per mark, right? And as per that calculation, as for a 6-mark question, you're getting nothing more than 9 minutes, right? And if you end up writing a lot in this particular question, since this is a question from paper 3, remember there's a 10-mark question that follows this question that would expect you to evaluate both of these studies too. So be mindful, and I hope this has helped. Yeah, I hope this has helped. Take good care of yourself. Stay happy, healthy, safe, and protected. Stay humble, spread positivity, spread smiles, and Allah Hafiz.